So we see a significant watershed moment with the George Floyd protests. People had been working on those issues for years. Really, we had consistent protest and organizing really following Trayvon Martin's death and a series of people who have been killed by police across the country from that time period. So we're looking at a period over more than 5 years. And when the George Floyd protests took place in the middle of the lockdowns, I think that prior work really had raised the awareness of people about this as a systemic problem, not a problem about individual police officers making bad choices, but as a problem that we see across the country. I also think that COVID made people feel more vulnerable themselves, and that seeing George Floyd in such a vulnerable position with a knee on his neck for many minutes, with people pleading for the officer to stop, people were able to connect with that, even if they weren't black or they came from a different background, and see that this is something that has to change. And that was very evident because we saw protests across the country, and not something that just flared up and died down, but the product of years of work following the protests after Trayvon Martin in Ferguson, Baltimore, and other places. This was the kind of change of public opinion in the United States was not something that happened magically overnight, but happened through really consistent and hard work, a lot of it behind the scenes over that time period. So the impacts of COVID in the United States have been very unequal, and we see that, and race is one of the major factors. So for communities of color, especially for Black and Latino communities, and as well as Native American communities, people in the community are impacted, dying at higher rates, getting infected at higher rates. And the answers for why that takes place have to do with the structural inequalities in our society. Things that for some people could be hidden are now becoming much more visible. So we see inequality in terms of housing, so where people live and whether they have access to good health care. We see that people who are on the front lines, who are doing what people are calling essential jobs, are often exposed more to the virus and don't have the opportunity to work from home, as well as communities that are more reliant on public transportation often face additional exposure. And so along the axes of race and also class, we're seeing communities of color impacted at really high rates. I think when we're looking at the issues of anti-Asian violence in the United States, we see that clearly COVID has been leveraged as a political opportunity by some to take what is a long-standing anti-Asian sentiment in the U.S. Of course, it's higher at some points in our history, and to really try to use that for political advantage, to use COVID to stoke fear of Asian people as enemies of the United States, for immigrants as potentially carriers of the virus or disloyal. These kinds of narratives and negative stereotypes have a long history that precedes COVID. And so during this time period, unfortunately, and prior to it, we've seen those kinds of resentments and really being stoked. And so the result, unfortunately and unsurprisingly from a conflict analysis point of view, is that that's led to increased violence. And we've seen that from 2015 forward, and especially over the last several years, that hate crimes against Asians have increased significantly. Most importantly, I think COVID is changing the conversation in the United States in terms of challenging us to really rethink how we think about security. In the case of COVID, the military, police, and other agencies that are tasked with the responsibility of security are left with a lot less power to try to impact that change and to protect people, right? Our best protection is in the quality of our healthcare system. It's in the kinds of systems that we have in place where people are able to have flexibility in their work so that they can stay safe, that we provide the kinds of materials, PPE and other kinds of materials that can keep people safe, and that we don't have communities in our society that are segregated and economically marginalized. And so I think the United States at least as far as the conversation goes in the United States, we're at a real pivot point in which we need to really rethink how we think about security, and to think about security as we're only as strong as we are able to support those who are most vulnerable in our society, and that we're profoundly interconnected, not as a metaphor, only as some kind of metaphor, but as a lived reality. And that kind of connection is not just only with our neighbors who live immediately around us, but with people who are in our city, who live in a different part of our city, who live in other states across the country. And as we've seen with COVID, and it's really revealed in a very practical way, we are connected to people who are on the other side of the planet. So I think COVID has really shifted the conversation, or is beginning to shift the conversation, to challenge us to think about how we think about security, what keeps us secure. And some of those answers are clearly that we need to create systems that protect the people who are most vulnerable, that create opportunities for them to be able to be healthy and thrive, and that we can't have people in our society, or even entire countries or regions of the world, that we just throw away or don't pay attention to the problems and challenges that they face. There is no magical place away where the problems that other people experience have no connection to us. And under normal times, we can think that and have a sense that we're more distant than we are, but COVID has reminded us in a really tangible way that we are profoundly interconnected, and our safety is dependent on the quality of our relationships and forms of connections with the people around us and the systems we have to support people across the society. So in my immediate research that's just been published in this book entitled Conflict Resolution After the Pandemic, I write about these themes of race and conflict resolution in the United States. And there's a number of points that I make. One, that conflict resolvers are going to need to work more with social movements, that social movements are driving forward conversations about justice in the United States. And that a key element of conflict resolution is democracy, right? Is democratic processes. And so we as people who have skills in facilitating conversations need to be involved and continue to be involved in meeting the demands that our society has around engaging more and more people around these key questions around how do we end police violence, how do we address the vulnerabilities that put communities of color at such high risk, and translate those conversations into policy. We see a growing movement around truth-telling in the United States around issues of race. I was involved in a project and have been involved in a project called the Ferguson-St. Louis Truthtelling Project, in which people came from across the country, family members who had lost loved ones to police violence. And that first step of sharing their stories and sharing their stories in a supportive environment with some resources around healing and networking with other people who are dealing with those issues is an important step for the people who are directly impacted by these issues, and for others to be able to learn about those, how people are impacted, people who are, like myself, who are not as directly impacted by issues of police violence, to think about how we can get involved. And so these national conversations around truth-telling, around issues of reparations, and how do we heal and move forward and continue to address those issues is important, as well as restorative justice, which is to say people have lost so much. And we have been living in a society where there are clearly people who are left out of many of the benefits of living in that society. So what is it going to take to restore our relationships, to restore opportunity for people? Those are conversations that are central for conflict resolution and will be key to rebuilding our country, and in particular also rebuilding our cities in the post-COVID era. So conflict resolvers and conflict resolution is not something that is on the outside of these conversations. The skills that people who are trained in conflict resolution, like those who come through the Carter School program here at George Mason in Korea or on the main campuses in the US, those skills are really directly relevant to how we're going to reshape our world so that we're in a better position moving forward and stronger together.